Good morning, everyone. I'd like to say thanks again to the organizers and all the sponsors, and most of all, thanks to the audience for making this conference possible and very interesting. I'm going to shift gears a little bit. I'm not going to talk about surgeries or chemotherapy or any of the things you've been listening to for the last day and a half. What I really want to talk about is MD Anderson and its global mission to eliminate cancer. I mean, as great as MD Anderson is, we do realize that we're not going to cure cancer alone in Houston, Texas, that there are others in the rest of the world that can help us do this. So we are striving to build a network of partnerships that can help us in this mission. So here we go. The mission, one of the main missions of MD Anderson Cancer Center is to eliminate cancer not only in Texas, in the US, but also the rest of the world. So this is clearly a big, important mission of our institution to build our global network of partnerships. As you can see here, we have built quite a network so far, and these are different kinds of relationships. Our formal relationships we sort of refer to as sister institution partners. But there are many other types of collaborative agreements that we have with others around the world that may not be listed here. And for those of you who don't know, because we're all in the medical field, but Houston, Texas, Houston is a sister city to Baku because of the oil. And probably this is part of the reason we're here. We have a center, an Azerbaijan center in Houston, Texas, that facilitates and helps with all the relationships, whether it's oil related, medical related, and so on and so forth. So if there's any interest in connecting with them, I'm happy to make that connection, after I'm finished with my talk. So here the global academic programs, it really serves our faculty at MD Anderson. And as you can see from the map, and we have 31 formal sister institution partners in 23 countries. Several of these are consortia. Now, what exactly is that? That's a combination of several institutions within the same country that partner together, and we have the formal agreement with the consortia. We believe that it's the largest network of cancer centers in the world, and it keeps growing. So hopefully one day we'll have Azerbaijan included, and we'll get started with this as of today. The network focuses on patient care, research, education, and prevention. Prevention is a big part of our mission because many cancers, as you know, are preventable if caught in the early stages. The next few slides are just listing all our partners in all the various countries of the world by alphabetical order. As I said before, there are many other collaborative partners that we have that are not listed here. So we have in Australia, in Brazil, Chile, China, Colombia, Denmark, France. I won't list everything, but you can read as I flip the slides. India, so Lebanon, Korea, and so on and so forth. Our consortia are in Norway, in Poland, in Japan, and recently in Thailand. So, and of course, we have in our partners at Hacettepe University. I don't know if Dr. Tesser Kutluk is in the audience, but he was very instrumental in creating that partnership and still is as we move forward with working with Hacettepe University in Ankara. The next this is MD Anderson Cancer Center in Houston, Texas. It's a little bit south of the downtown area of the city. You can see in the background, that's downtown Houston, Texas. It's really a business city. Nobody ever visits Houston for vacation. They come there for because of oil and gas, or they come for medical reasons, or they come to the Space Center. That's it. Nobody comes, or they have family there. Nobody ever plans a vacation to Houston. They go to Florida, California, New York. But anyway, the next few slides will just show a little bit of information about MD Anderson Cancer Center. I didn't go into too much details. It's just basic information about the departments and things that we do there. We're almost 75 years old. This began back in 1941. And as Dr. Aziz mentioned earlier, MD Anderson was not even a physician. He was not even a doctor. He was a cotton broker from, not even from Texas, from the state of Tennessee. Somehow he got to Texas, and when he passed away, he had no family. He left all his monies to the state of Texas with instructions that they should build a cancer center. So that's really the origin of MD Anderson Cancer Center. So the MD really refers to, his name was Monroe Dunaway. The MD is not MD as in a physician, which most people think. But anyway, just a few facts. We see about 120,000 patients per year, and a third of these are new patients every year. Now, where do the patients come from? Probably a third comes from the city of Houston, another third from the rest of, actually no, from the surrounding areas, and another third from the rest of the country. We do have many international patients, but in the big picture, it makes up a small percentage of the patients that come to Houston, or that come to MD Anderson for care. We've been ranked number 1 or 2 over the last 25 years or so within in the U.S. News and World Report. We have a large number of employees and staff. We have trainees, we have volunteers. This is very important to the functioning of and the running of the hospital. Additionally, we have the largest cancer clinical trials program in the world, over 1,000 clinical trials. Just about any cancer drug that's been evaluated probably has a trial ongoing at MD Anderson Cancer Center. Also, besides treatment and surgeries, MD Anderson focuses a lot on research. Research is a big part of MD Anderson Cancer Center, so there's a lot of money invested in the research infrastructure and departments at MD Anderson. And as you can see, from the National Cancer Institute in the US, we receive most of the research monies. And of course, this is not given to us just because we have a name. There are grants and applications that our faculty have to constantly provide and apply for, and there's a scientific review process, and so on and so forth. Let's go on. We're divided into clinical divisions and basic science research departments. So just to give you a listing of all the clinical divisions, and these are research-driven, and they practice multidisciplinary care for the patient. Now, exactly what is multidisciplinary care? It's the oncologists, the surgeons, the radiation oncologists all come together to review that patient and decide on the best treatment for the patient. So it's not just one physician making the decision on what is the best care for the patient, but all 3 or 4 involved physicians will decide this is the route for this particular patient. The Division of Cancer Medicine, the second one there on the left, it's a very large department. That's the one you will see, and I'll move on to the other slide so you can see all these different departments are within that division. So you will recognize many of the areas: breast, GU, head and neck, leukemia, so on and so forth. Another thing I'd like to briefly mention, we recently, about 2 years ago, we announced, 2.5 years ago, we announced a sort of a moonshot program. And what this is it's a comprehensive plan to accelerate the pace of research in certain cancers. And the 6 areas that were decided upon initially are the women's cancers, breast and ovarian, lung, prostate, melanoma, and the 2 leukemias. So the institution is putting a lot of money into the research part of these cancer programs. And now I'll get just a little bit about our sister institution global partnership that we have. These are academic partners with broad engagement across across multiple areas within our institution. And the sister institution network really supports the faculty. And how do we get these, how do we start these relationships? Why do we have these relationships? Many of these relationships started because our faculty came to us and said, we would like to do certain things, or we have this collaborator at hospital XYZ in China, Japan, Korea, wherever. And so, you know, one of the key areas, one of the key reasons we have a partnership wherever we are is because our faculty wants to be there, and they want to do collaborative research with that institution. So this is the criteria for the sister institution membership affiliation. We must have faculty champions in Houston, Texas. Again, it takes about 1 to 2. That's on the short side. Many of our relationships take a longer time to build because things don't move as fast as we would like them to move. Sometimes it takes a much longer time. You know, we have to assess the facilities. There are multiple site visits back and forth between the institutions to Houston and to the site. And then there's a criteria we use. We use a scoring mechanism. And then once we feel that the institution is at the level that we feel covers all the areas that it needs to cover, and also we have the faculty champions who really want this, because why do they want this? Well, you know, sometimes, as I said earlier, we cannot do everything at MD Anderson. Sometimes we need our global partners to help us do, for example, maybe run a clinical trial, you know, get more patients on the trial. Or they may do more head and neck surgeries because, well, they see more head and neck patients in their country or in their hospital. And this is the case with many of our partners. I mean, as many patients as we see at MD Anderson, there are many institutions around the world that see a lot more patients than we do in Houston. So finally, when we get to the point, the institution is presented to an advisory board, and a recommendation. You know, the board hears the recommendation, and then the board also votes on whether this institution should become a sister institution. If it's a yes, then it goes to the president, and he formally signs off on it. And it's a 5-year contract, and some of the things that are considered are just the status in the country, you know, the impact that the relationship will have on MD Anderson. What is the plan for collaborations between Houston and the site? Just the infrastructure and all the capabilities, and what sort of support the institution really has to carry on research and clinical activities. So what is it that we do in the global academic programs? With all the sister institution partners and other global partners that we have, because I only mentioned the sister institution partners up there, but there are other collaborative agreements that we have that we also facilitate. We host visitors. I know there's always a lot of interest for, especially clinicians and surgeons, to come and spend time at MD Anderson. MD Anderson is an academic institution, so any one of you in the room can come to MD Anderson if if you want to, and if you have the time and the monies to get there. But in a nutshell, this is part of what we facilitate also through the global academic programs. But there are many other. We have observers that come there and spend 1 week, 2 weeks, 1 month, or even more than months. If they're doing research, they can be in a clinical lab or a research lab for up to a year or more. Again, we visit institutions. This just shows a little bit of our activities over the last. We do this. We update this quarterly. So this shows for the last quarter what we have done in global academic programs. And then another one of our another one of our activities actually resulted because we got we had a special request from our partners in China to send patients to Houston, and they said, we don't know how to do this, we need help with this. So our department decided to formalize and hire one person who facilitates patient referrals to MD Anderson Cancer Center. And it started in China, but we also have a lot of patients from Latin America, and even we have patients from here sometimes. We have patients from everywhere. So the person in our office who handles this, her name is Chi, and she actually provides a kind of a concierge service for patients trying to come to MD Anderson. She will contact them. She will facilitate it through the international department. She will be the liaison. So if anyone needs this information or help, I can certainly connect you with that person. And then a big part of global academic programs is actual research projects. With all our partners, actually, we have specific research projects going on between Houston, MD Anderson, and the partner, wherever that partner exists. And the projects vary in many different fields. It depends what's the interest of the institution. Some institutions have a vested interest in cervical cancer or head and neck cancers or leukemia. So it depends on the interest of the partner, what research projects they decide they want to do. So this shows a listing of some activities that actually we have funded. When I say we have funded, the institution, just when we started the network of partnerships, there was no monies for research, and everyone came to us and said, but do you have money to do research? And we said, no, we had no money. So our leadership, our boss went to the leadership and presented a proposal that the institution would allot X number of dollars for specific projects. And this is a competitive process also. It involves sending in an application, and the one thing, you must have a principal investigator at MD Anderson Cancer Center. So that's one of the criteria. So if there's an interest in a specific project or in whether it's clinical work or surgical work or basic science, we must have a partner in Houston, Texas. The grants are reviewed, and then the applicants are selected and based on different scientific reviews and things like that. So our sister institution network funding program, as we call it, has over the years, and right now we have about 82 projects going on between Houston and the rest of the world. And this shows you some of the locations and the kinds of activities that exist. Many of the SINF projects have resulted in a lot of papers and publications. So this is one of the ways we also sort of monitor and measure the criteria. As you can see, they're not just clinical. Many of them are basic science research projects. Okay, anyway. And they're really focused on everything, you know. They're cancer, of course. MD Anderson is a cancer center, but they focus on all areas of cancer, and like I said, basic clinical, translational, whatever is the interest of the partner, of our partners. And this shows publications from our faculty since we started the Global Academic Programs department. We have the publications between Houston and the rest of the world has increased somewhat, we feel, because of our Global Academic Programs activities. And this graph shows when we started, when GAP started, and also when we started the Sister Institution Network funding, which was only started about 4 years ago. So we're going into the 5th year, and hopefully we'll have another round of funding for the Sister Institution projects. But you can see that these activities result in many more publications between the PIs in Houston and the PIs in the rest of the world. Just the next few slides will just show some of the clinical activities we have going on around the world. Here we have a clinical trial with the Clínica Las Américas in Medellin, Colombia. We have another one in Shanghai, in China. We have with the Sheba Medical Center. And this really doesn't list all the activities. It's just to give you an idea of what sort of trials we have. These are clinical trials. What sort of trials we have going on with our partners around the world. Another big part of our program is prevention. We also have cancer prevention activities and tobacco control activities. This has been a real focus of the institution in the last few years. Again, a lot of research support has been added to the programs there in order to enhance these activities. And, in the process, we're sharing it with the rest of the world. So just a few things there, in Colombia, in Mexico, we've signed agreements with the city, with the state to help them in their cancer control projects and programs. And we also are doing some of this within the state of Texas. So, education. One of our, actually, this is the signature event of our Global Academic Programs department, is our annual Global Academic Programs Conference. And we started this at least 7, 8 years ago. And most of the conferences have been in Houston, Texas. In fact, for the first 6 years, it was always in Houston, Texas, until our partners started to say, why don't we have the conference in another country, hosted by another partner, et cetera, et cetera. So this slide shows the numbers have increased over the years. The first time we went overseas for this conference was our partners in Norway hosted the conference. And you can see the numbers increase. Of course, whenever you in a certain country, you will have more people from that country attending. And last year we were in Seoul, Korea. Again, we had obviously a lot of Koreans participating in the conference. So this year now we're back in Houston, Texas. We're back in Houston, Texas, and it takes place in a month from today exactly. So we invite you all to come. If you would like to, it's open to all our partners, everyone, that we never say no to anyone. So if there's interest, I'm happy to share that with you after my presentation. And just a little bit more on some of the other activities that we do. Besides hosting visitors, we also have video conferences with our partners around the world. Now, what do? We don't discuss, the physicians get together and discuss specific cases, minus the name of the patient, because we're not able to share patient names. But so we do this whenever there's an interest, whenever we have physicians that want to facilitate or assist or help their partners I personally am involved with the ones we do with Brazil. Every couple of months, we do a urology, a GU video conference session where we have the urologist, the medical oncologist, and the radiation oncologist coming together. Our sites in Brazil send their cases in advance, and then everyone gets on the video conference in real time, and the cases are presented by the sites, and then the best treatment plan is discussed amongst the physicians in Houston and at the site. We also have done these in the past, also with India, with the head and neck department. We used to do these quite a bit. So this is based on interest and availability, and whoever would like to participate in these, because it does require time and effort from both sides to facilitate. But once you have the time and you've decided this is something you want to do, we're happy to facilitate this. And so those are video conferences. We also have joint conferences, either in Houston or at the partner site. This is an example of one of the conferences. We have 3 physicians here from MD Anderson, but we have many of these conferences with our partners all over the world. And this is a good way to make connections, to meet the faculty, and to continue activities between the physicians and the researchers. This is just more about the organization and the governance, how the vice president of our department reports to the provost and oversight committees. And, we are a very small office. There are about 10 of us in the office. And the institution really has seen our department as a big investment in the institution, and really our leadership has supported the Global Academic Programs Department. They feel that it's important it's an important global network for the rest of the world. As I said earlier, it's important that we connect with the rest of the world, because we will not just cure cancer in Houston, Texas. We need the help also from other people, other players. And then lately, we also are quite connected with the Center for Global Health. There's a lot of activity going on recently between the NCI in the United States and our hospital. Dr. Kathleen Schmiller, one of our GYN physicians, she recently got a grant from the NCI, and it was a competitive process. Many physicians, researchers at MD Anderson applied for this grant, but in the long run, Kathleen was the one that received it. It was a $200 a year grant. She and her colleague has come up with this low-cost optical imaging test for cervical cancer, and actually they're actually running this test right now in Brazil, and they have plans to expand it to other countries of the world, also probably to Africa. I know we have a big initiative to begin activities within the African continent, and we have the Union for International Cancer Control helping us with this. Clearly, Africa is a different country, different countries, and their needs and wants are different than most of our other partners, but we feel that it's important that MD Anderson should have some presence there, so we are looking forward to other activities and partnerships there. They'll be different than our existing partnerships, obviously, because their needs are totally different. And lastly, but not least, just inviting you to come to the conference in, okay, when did I get this? Anyway, Houston, Texas. These are the dates. Oh, I get back to there. this is our conference. Like I said, if you would like to know more about it, I'm happy to share that information with you. And if there are any questions, anyone wants to speak with me, I'm here for the rest of the day. So please feel free to just come up to me and ask me a question. This is, I'm happy to answer. So that's the end of my presentation. Thank you very much.